Hello, my name is Alexis Maldonado, and today I will be talking about cardiomyopathy and all the factors that come along with it. What is cardiomyopathy? Cardiomyopathy is basically a disease within your heart where the heart muscle actually begins to lose the ability to pump blood effectively throughout your entire body. As you can see in the picture, those tube-like things are actually ventricles, and you can tell that when something small, like a tear, occurs, a lot of material overcomes it, which makes it hard for the blood to flow through. As cardiomyopathy progresses, the heart becomes weak, less able to pump blood through the body, which then causes heart failure. There are actually three different types of cardiomyopathy a person can have. The first being dilated, the second being hypertrophic, and lastly, restrictive cardiomyopathy. In the picture on the left, you can see how each different type of cardiomyopathy affects the heart. I will be explaining each one in more depth. These are some signs and symptoms all three cardiomyopathies have in common: heart weakness, tiredness, shortness of breath, and swelling. The swelling actually only occurs from the abdomen and below. Dilated cardiomyopathy is a condition where the ability of the heart to pump blood decreases. This is due to the fact that the left ventricle, which is actually the main pumping chamber, becomes enlarged and weakened. The fact that it weakens is because when it stretches and becomes thinner, the blood does not circulate evenly. This is the most common form of cardiomyopathy, which is generally between the ages of those 20 to 60 years of age. This is also more common in men. Pictured here, you can see how the left ventricle is enlarged, which then forces the right ventricle to become smaller, and both do not help blood to be pumped throughout the body. Next, we have hypertrophic cardiomyopathy. This happens when the muscle around your heart thickens abnormally. There are two different types of this one, which is obstructive and non-obstructive. Here we have the hypertrophic cardiomyopathy obstructive, which happens as the septum thickens, which forces a bulge into the left ventricle. The symptoms for this one are chest pains, dizziness, fainting, and the shortness of breath. The picture on the right shows a normal heart and how the heart muscle thickens, which begins to cover your left ventricle. Now I'll explain the non-obstructive, which is mostly common in young people, including young athletes. This can cause cardiac arrest within this group of people. Your ventricle will thicken, but also cause the heart muscle cells to enlarge. The picture shows how the muscle has thickened compared to a normal heart, and how that reduces the ventricles that help and allow pumping of blood to the body. Lastly, we have restrictive cardiomyopathy. This affects older adults. The ventricles lose shape and feeling as they become stiff and rigid. This can cause heart failure. Some causes that trigger this cardiomyopathy are radiation therapies, infections, hemochromatosis, which is a condition in which too much iron is deposited into tissue, including heart tissues, and lastly, amyloidosis, which is a disease in where abnormal proteins are deposited into the heart tissues. This is a rare heart muscle disease that is caused by restrictive filling of the ventricles. Long-term alcoholism, long-term high blood pressure, and diabetes play a risk factor in all three. All three types of cardiomyopathies have very similar medications that will be prescribed by a doctor. Digoxin increases the force of the heart contractions and slows the heartbeat. Antibiotics helps prevent an infection of the heart walls, valves, and vessels. Corticosteroids, which reduce inflammation. Antiarrhythmia, which keep the heartbeat at a normal rhythm. Anticoagulants, prevents the forming of blood clots, mainly for the dilated cardiomyopathy. Here are some of the main sources I used to gain more knowledge on cardiomyopathy. If you want more information, you can click the links listed. Thank you for your time.